and welcome back to Focus on Health. I'm Lauren Buck, the Director of Public Health for the City of Revere, and I have here with me again my colleague Hajar Bichou. Welcome, Hajar. What are we going to be talking about today?
Hello, Revere. Today we'll be talking about some important tips like how to stay healthy during the upcoming fall and winter months, along with some information about monkeypox. And lastly, we will be talking about National Suicide Prevention Week and give some new national resources that are crucial for our residents to know about.
Thanks, Hajar. Let's start with some basic tips about staying healthy this season. We now are heading into fall and winter weather, which means we need to be prepared for respiratory illnesses, anything from the flu, common colds, and yes, that's right, COVID. There are some really basic things that we all should do in order to stay healthy. Hajar, let's start with tip number 1.
During fall and winter, it is especially important to practice good hand hygiene. Everyone should wash their hands with warm water and soap, or use an alcohol-based hand sanitizer. Make sure to do this frequently over the next couple of months. And don't forget, you should be washing for at least 20 seconds every time. This is about the length of singing the happy birthday song.
Great tip, Hajar. Next, we want to remind everyone that it is more important than ever to stay home from school or work if you or a loved one is feeling sick. Germs spread very quickly in a school or workplace, and the best way to make sure your coworkers or schoolmates don't get sick is to stay home if you are not feeling well. Even a small thing like a runny nose or a cough could actually be a respiratory viral illness, so make sure to monitor you and your family for respiratory symptoms this fall and winter. Hajar, what is our last tip for everyone?
Our final tip is a reminder that there are a lot of resources out there to help prevent the spread of respiratory illnesses this season. Putting on a mask in a crowded indoor space is always a good idea if you are immunocompromised or if someone in your family is immunocompromised. Also, keep an eye out for flu vaccine, and the newest COVID vaccines. You can always visit the Public Health Department's website at revere.org for information about our weekly vaccine clinic this fall. Lauren, let's talk about monkeypox next.
Thanks, Hajar. I wanted to spend some time talking to all of our Revere residents about the monkeypox outbreak that I'm sure you've heard about on the news over the last few weeks and months. As of yesterday, there have been 336 confirmed cases of monkeypox in Massachusetts since early May. But monkeypox is a much different illness than COVID. It is a rare viral illness that can present in humans with flu-like symptoms and a rash with lesions on your skin. While many of the identified cases are within the gay and bisexual men, men who have sex with men, and transgender individuals who have sex with men community, it is important to remember that people of any sexual orientation or gender identity can become infected and spread monkeypox. The virus does not spread easily between people, however. Transmission is most frequently occurs through direct contact with monkeypox rash lesions, scabs, or body fluids. There is both a medication and a vaccine available for this illness, for those who have developed the illness and for those who have been exposed. The best course of action if you or someone you love has symptoms or has been exposed to someone with confirmed monkeypox is to call your healthcare provider. The Revere Board of Health is also available to help answer questions at the number on the screen below. Finally, we wanted to talk about a very important topic. We are in the middle of National Suicide Prevention Week here in the U.S. Hajar, what can you tell us about some important resources that are out there?
That's right, Lauren. The first week of September is the National Suicide Prevention Week. Since this July, the 3-digit code 988 has been designated as the National Suicide Prevention Lifeline across the United States. This means that if you or anyone you know is thinking about suicide, or if you are worried about a friend or a loved one, or would just like an emotional support, you can dial 988 on any phone, anytime, 24/7, and you'll be connected to the support line. This is a great resource that we want to make sure everyone here at Revere knows about. Your call is confidential and free. No matter what problem you are dealing with, whether or not you are thinking about suicide, or if you need someone to lean on for emotional support, call 988. Talking with someone about your thoughts and feelings can save your life.
Thanks so much for sharing that amazing resource, Hajar. Again, while we are in National Suicide Prevention Week, we want to make sure everyone knows that 988 is the National Suicide Prevention Lifeline. Please use it if you are struggling. Hajar, thanks for joining me on our latest episode of Focus on Health. Until next time, Revere, stay healthy.